Well, hello there, space monkeys. Welcome to Political Fight Club. I'm Robert Durden. I'm going to read Dreamland by Sam Quinones again today. This is chapter 29, I believe, and it's a long chapter. It's called Liberace Shows the Way. Liberace? Liberace. That's what we're going with for the rest of the chapter. And since it's kind of long, we're going to split it up into 2 episodes, I think, here. So otherwise, I'd be on here for like 40 minutes. It is a good chapter, though. Start on page 153. This is Dreamland. Liberace Shows the Way. Portsmouth, Ohio. By the end of the 1990s, Dr. David Proctor was one of the few people doing well in Portsmouth, Ohio. He had himself a $750,000 mansion with a swimming pool, African art, and 2 7-foot bronze storks. He owned a Mercedes, a Porsche, and a red Corvette, rare possessions in the Ohio River Valley. In the late 1980s, the Kentucky Board of Medical Licensure investigated patient complaints of unethical practices against him. Board agents found that he prescribed opiates aggressively and often without much diagnosis or follow-up. He was found to have violated no Kentucky medical regulation and retained his license, but was placed on probation. In fact, the state records reflect that a doctor who prescribed the drugs often yet discontinued them just as frequently, who consulted other physicians and urged his chronic pain patients to use exercise or physical therapy to control their pain. David Proctor seemed to be searching for solutions to what ailed his patients. A decade later, that had changed. A nurse in California once told me, when you deal with people who are in pain all day long, after a while you get worn down. Something like that happened to David Proctor. More patient complaints in the 1990s prompted a second state investigation. By then, those records show he regularly prescribed Valium, Vicodin, the sedative Soma, Xanax, and a steady regimen of Redux diet pills, all with almost no diagnosis or suggestions for other treatments such as physical therapy. Nor was there any discussion of improving diet as a way to lose weight and reduce pain. As I read the Licensure Board investigative reports, it seemed that many years in deindustrialized America, seeing vulnerable people and manipulative people who use drugs and the government dole to navigate economic disaster and corroded any medical ethics Proctor once possessed. So I went to Portsmouth to see if I could learn more about the doctor whom locals called the godfather of the pill mill, the man who had started the first business and showed others how it was done. No one in Portsmouth had forgotten David Proctor, though he was long gone by then. Some remembered him fondly. Many said they had gone to his clinic and waited in long lines for dope prescriptions. One of them was Kathy Newman, who in 1996 was a high school cheerleader and the daughter of a contractor. Kathy had just graduated from Portsmouth High School when she broke ribs in a car accident. The emergency room in town was wary of prescribing more than ibuprofen for pain. "You should go see David Proctor," her friends said. "He'll give you something that works." Kathy drove to the South Shore Clinic and walked into a madhouse. The room was packed. People were standing in the aisles, tense and greedy with anticipation. After 3 hours, she got in to see the doctor. Proctor prescribed her Vicodin and spent a half hour telling her that she would probably have back and hip pain for the rest of her life, and thus would need this prescription for well that long. Newman went along with it, not sure what to think. "I'm scared to death. I'm so young and afraid that I was going to be on this for the rest of my life," she said. In fact, those Vicodins led to a 14-year addiction that eventually had Newman shooting up OxyContin and getting pill prescriptions from a half-dozen doctors around town. Years disappeared in zoned-out addiction. She once found herself in an abandoned farmhouse with people she didn't know, unaware of how she got there. A pit bull ran through the living room, chased by an enraged rooster. The pain treatment revolution had many faces, and these mostly belonged to well-meaning doctors and dedicated nurses. But in the Rust Belt, another kind of pain had emerged. Waves of people sought disability as a way to survive as jobs departed. Legions of doctors arose who were not so well-meaning, or who simply found a livelihood helping people who were looking for a monthly government disability check as a solution to unemployment. By the time the pain revolution changed U.S. medicine, the Ohio River Valley had a class of these docs. They were an economic coping strategy for a lot of folks. They charged cash for each visit, and were quick with the prescription pad, willing to go along with whatever the patient claimed was pain, wherever the patient claimed he had it. Then along came OxyContin. If heroin was the perfect drug for drug traffickers, OxyContin was ideal for these pill mill docs. The drug had several things going for it, as far as they were concerned. First, it was pharmaceutically produced pill with a legal medical use. Second, it created addicts, and not just among those who looked to abuse it, but among many who came in search for pain relief. Every patient who was prescribed the drug stood a chance of soon needing it every day. These people were willing to pay cash. They never missed appointments. If diagnosis wasn't your concern, a clinic was a low overhead operation, renting a building, a few waiting rooms, some office staff, and some bouncers. These clinics did require bouncers. They also required a physician with a DEA registration number that permitted him to prescribe federally designated Schedule II narcotics like Oxy. Prescriptions for Schedule II drugs had to be written each month by a doctor for a patient who had come to the office in person. That meant a monthly fee from every patient, $250 usually, and that kept waiting rooms full and cash rolling in. Among the very first docs in America to figure out the potency of OxyContin as a business model was David Proctor in Portsmouth, Ohio. He believed all his patients. Not only that, he encouraged them to believe in imaginary pain. Injured people start going to him, and he gives them this new wonderful medicine, OxyContin, said Lisa Roberts, a public health nurse in Portsmouth, who had worked with Proctor years before at a hospital where he had privileges. Soon they were getting addicted. They'd say, "My pain's getting worse," and he'd increase the dose. I started seeing people I know, who are hardworking, decent people, acting all bizarre, rolling cars, stealing. Danny Colley, who grew up in Portsmouth's rough East End neighborhood, watched Proctor's gradual corruption. Proctor had been his family's doctor when he was a child. At 20, now fully involved in the drug world, Colley visited his former doctor's clinic. Proctor was the first cash-only doc around, and was by then prescribing Xanax and Lortabs for everything. Later, he became the first to prescribe OxyContin for Colley. His clinic was full. He was only one guy, and he was burning it down, Colley said. When he gave me the Lortabs, he said, "Put these under your tongue and let them melt. Do not snort them." When I got my first Oxys, he told me to be careful, but that I could snort those. His exact words. He gave me the same thing he said he was taking. He's giving me the dope I need so I'm not sick. I thought he was my dude. I thought he was looking out for me. I thought it was the coolest thing ever. Colley went to Proctor after being injured on a job. He got workers' comp to pay for my medicine for a year and a half, Colley said. He was helping with that. He had a photographic fucking memory. We all thought he was the smartest person in the world. He was brilliant, but he was a crook. Local doctors took a cue from Proctor. Dr. John Lilly opened in downtown Portsmouth. He had lines out the door too. After that, things opened wide. Kathy Newman noticed it wasn't just the unscrupulous docs. It seemed every physician in town was under the influence of opiates' remarkable pain-killing potential. Anyway, she could find no doctor in Portsmouth offering a pain solution that didn't involve opiates. They'd be like, "Well, let's try you on Lorcetins," or "That didn't work for a month, well, let's move on to 20s, Kathy Newman said. Within 3 months of me telling them that Vicodin 5s aren't working anymore, I was on Oxy 20s, paying cash all the way. Doctors prescribed those drugs. The other truth, though, is that opiates were all most patients demanded in southern Ohio by then. So we'll start up again on page 156 tomorrow, and we'll finish the chapter. Hope you guys are enjoying the book. I am. Keep fighting that good fight out there.